Good afternoon and welcome everyone to the Bergen Passaic Ryan White Part A Technical Assistance Monitoring Webinar. We appreciate each of you being here today. So very quickly, we'll do brief introductions of collaborative research for those of you who have not had an opportunity to meet us. We are a consultant to the Ryan White Part A recipient for the city of Paterson. And we will be conducting the grant year 2021-22 annual comprehensive monitoring site visits for all Ryan White Part A funded sub-recipients. This will include fiscal, programmatic, and universal monitoring standards. I am Thomas Rodriguez-Shucker, project manager for the monitoring process. Have my colleague Michael with us. Michael?
Hi, I'm Michael Cran, monitoring project lead with Collaborative Research.
Derek?
Hello, my name is Derek Jackson. I'm the monitoring project assistant.
And Sarah?
Hi, everybody. I'm Sarah Seberg, and I am another monitoring project assistant with Collaborative Research.
Great. Thank you, team. And now that you had an opportunity to meet us, we would like to do quick and brief introductions. And I'll lead that process by basically calling on the sub-recipient. And if someone from that organization is with us, please give us your name, your preferred pronouns, obviously the agency you're with, and the title or position that you hold within that agency. And we'll start out with Bergen family. Ms. Paula, thought I saw you.
Paula Tenebriso, a licensed clinical social worker, and I supervise our HIV/AIDS program here at Bergen Family Center. We're funded for outreach, early intervention, and mental health.
Right. Great. Thank you, Ms. Paula. Any colleagues with you today?
No.
Okay, great. Buddies of New Jersey.
Good afternoon, everybody. Rick Miles, Executive Director, Buddies of New Jersey, also Chair of the Bergen Passaic Transitional Grant Area.
All right, great. Thank you, Rick. Any colleagues with you today, sir?
No, I'm sorry, conflict you said?
Any colleagues?
Oh, colleagues,
Anybody
I'm
else?
sorry, no, not today.
All right, great, thank you. Capco.
Yes, Sandra Rodriguez, CAPCO and Community Case Manager.
Great, thank you, Sandra.
You're welcome.
Mr. Jerry?
Hi, Jerry Dillard, Executive Director, CEO at Capco Resource Center in Paterson. And we also have with us Jessica Stigliano,
Hi,
Case
everybody.
Manager.
Nice to meet you guys.
Great, welcome Jessica, Jerry, and Sandra. Thank you all for joining us.
You're welcome.
All right, City of Passaic. Anybody with the City of Passaic?
Miriam just introduced herself when she got on the line. Maybe she got bumped off.
There she is.
Can you hear me now?
There you are, yes, ma'am.
Okay, good afternoon. It's Miriam Torres of the City of Passaic. And at the meeting also is Grace Jones and Luz Rodriguez, case managers.
Great. Thank you all for joining us today. I knew I saw you. I just was looking through the pictures up there to see who was still with us. All right. Thank you, Miriam, Grace,
You're
and
welcome.
Luz. All right. Hackensack Hospital. Oh, I see Miss Donna. You're on mute, Miss Donna. Oh, and Miss Irene.
Hello, can you hear us now?
Yes, ma'am.
Oh, great. Okay. Hello, I'm Donna Wilson, and this is Irene Panagiotis. I'm the patient care coordinator for the ID outreach program, and she's the medical secretary. We go by she and her.
Awesome. Thank you both for joining us. Hyacinth AIDS. Anybody from Hyacinth? All right. Northeast New Jersey Legal, I see Miss Mallory.
Yeah, hi everyone, Mallory Ware. I am the Development Manager at Northeast New Jersey Legal Services.
Thank you for joining us.
Of course.
Paterson Division of Health. Anybody from the Health Department, Paterson? All right, Paterson Counseling. Anybody from Paterson Counseling? All right. Payne, Mr. Roger Lester.
Roger Lester, Pain, Preparing Adolescents and Adults Ideologies Now. CEO/executive director, non-medical case manager, substance abuse counselor, health education worker.
And outreach. All right, great, thank you. Any colleagues with you today, Mr. Roger?
Jerry Dillard, jack of all trades.
All right, thank you all very much. All right, St. Joseph's, anybody from St. Joseph? Don't see anyone. St. Mary's, I think I saw Priscilla.
Hi, everybody. This is Priscilla from St. Mary's General Hospital. I have
Jeanette Rodriguez.
also
from St.
here.
Mary's.
Great, thank you ladies for joining us. Straight and Narrow. Just saw everybody from Straight and Narrow. And Team Management 2000. Okay, those are our 14 subrecipients that we just named off, for those of you who may not be familiar with all the services. And so right now we'll go ahead and begin the monitoring process. But before we do that, we left one key ingredient out, our fearless leader, Millie. Would you like to introduce yourself?
Good afternoon, everyone, and thank you for joining us. My name is Milagros Izquierda, the recipient for the Paterson Passaic Bergen County TGA. And I also have our program analyst, Denise Kova.
Hello, everybody.
Hi, Miss Denise.
Hi.
Good to be back.
I hear you. It'll be good to see you soon. All right. So this year's process is going to look a little different from what you are used to in previous years. In that collaborative research will be conducting the annual monitoring process. This will include chart reviews, universal monitoring and programmatic monitoring reviews, which typically means policies and procedures and service delivery particulars, and then also the fiscal monitoring component. Just to give you a little bit of background about collaborative research, this will be the 20th year that collaborative research has supported Ryan White programs across the entire nation. And so we work from East Coast to West Coast currently with about 13 different jurisdictions in Ryan White, CDC, HOPWA, prevention, and EHE programmatics. And we do conduct multiple monitoring just like this across the country for 5 other jurisdictions that is very similar to this. So I assure you this process will be very streamlined. It may seem a little fast, so if there's something you're not quite understanding, we encourage you to speak up and ask questions because we don't want to leave anybody behind in this process. It can be very all-encompassing and very, it seemed like a heavy lift, and it probably is since this will be your first time working with our process, but I assure you that myself and my team are here to help you be successful at this monitoring process. And then the final takeaway from everything that we do today is that monitoring is not a aha, we got you type of moment. This is a moment for us to make sure that we are doing what HRSA and HAB recommends us to do, and we do not jeopardize the funding for our jurisdiction and the people that we take care of. That's our main takeaway from this, right? We are partners in this with you and not somebody who's standing above you to say, oh, you're not doing this right. We want to make you be successful and help you in any type of way that we possibly can. All right, with that being said, we'll roll right into the monitoring process. And so again, this process will consist of 3 different components. The first component being fiscal monitoring. That will be conducted virtually via Zoom if we need a face-to-face or a interview with key staff about fiscal items. Universal monitoring will also be virtually using what we call an FTP site. So if you see at the bottom of the screen, for each the fiscal and universal monitoring, it says that requires an FTP upload. And we'll talk about that a little bit later, what exactly that means. And then finally, we'll look at service category chart reviews and performances. And we're going to do a mixed bag this year. So we're going to do some in person and we're going to do some virtually. And we'll utilize the Ryan White Part A National Monitoring Standards. We'll utilize Policy Clarification Notice 1602. And more importantly, we'll use the Bergen Passaic Approved Service Standards. Again, and some of these will be online and some will be virtual. And we'll look at the monitoring schedule in a little bit. So first, we'll talk about the fiscal monitoring components. Fiscal time frame that will be reviewed is for the months of May, August, and November of 2021. So this monitoring process will encompass the entire grant year for 21-22, meaning anything done from March 1st of 2021 to February the 28th of 2022. While we are looking at the fiscal requirements of this, we will be utilizing 2 CFR 200 and 45 CFR 45 and HRSA-HAB program letters in the guidance for the fiscal monitoring compliance. If those sound a little foreign to you, you may want to talk to your fiscal staff. I assure you, I hope I assure you that they know exactly what we're talking about, especially the 45 CFR 75. It's kind of the code of federal regulation that aligns itself to how grants should be administered. Next, with the review of the fiscal monitoring tool. So we'll take a quick look at that. We'll give you a very high level look at that. Some of you had the opportunity to do kind of a quick pilot program last year prior to the virtual site visit. And so you'll have a fiscal monitoring tool that aligns with each of the requirements of the national monitoring standards. And in some instances, if the questions are relevant to your organization and the type of funding that you receive and the services you provide, you'll be asked to upload a particular compliance document that aligns with that question in the fiscal monitoring tool. And again, we'll look at that a little later of how those things kind of align. The expectation will be that subrecipients upload the documentation for compliance to the FTP site. And again, this FTP site is web-based and it is HIPAA compliant. So just like with any type of EMR or any type of information that stores private records, we ask that you do not share your credentials once you receive them. And if someone within your organization needs to get to the FTP site, that they request their separate credentials so that we can keep a HIPAA compliant tracking of logins and utilization. And then finally, after we review the fiscal monitoring uploads for compliance, if it's necessary, we will reach out to the individual organizations who we may need an additional interview with just to kind of clarify or talk about some things. And so that will be scheduled once all of the fiscal documents have been uploaded. Any questions thus far? So you may be asking yourself, what type of things are we looking for in fiscal? So if you read through the national monitoring standards, we'll be talking about things like limitations of use, making sure that costs are an allowable Ryan White cost, right? You're not out there buying cars for people. You're not out there buying homes for people. We're not taking people up to the water park or down to Busch Gardens, right? So making sure that things are allowable costs. That kind of rolls into number 2 as well with allowable costs. We'll also talk about income from fees. So HRSA-HAB requires that each organization providing medical services or services that have a charge to them, that they have a sliding fee scale. So we will be looking for policies and procedures in alignment with those types of services. We'll also talk about imposition of charges and assessment of client charges that goes along with your sliding fee scale. We'll ask questions with regards to policies and procedures about fiscal management, property standards, cost principles, your auditing requirements, whether you are required to do an A133 audit or a single audit, and then also additional fiscal policies and procedures as required by HRSA-HAB. Again, all of the compliance documents will be uploaded in accordance with some of the questions. So here's a quick example of what that fiscal monitoring tool will look like. It is in Excel, however, there are checkboxes. And so for instance, let's say we're working on number 42. And again, these are just examples, so these will not be the same questions that we'll see, but it'll be very close. So number 42, do you have subcontractors, including contract employees funded by Ryan White? If your answer is yes, then you'll upload a list of active subcontractors along with the annual budget for each of those service providers that you're contracted with, right? If that's a no, you just simply skip the question, right? Or click other and type in NA, not applicable. And so when we look at the FTP site, if you have documentation that shows compliance to number 42, you'll simply upload that document to Fiscal Q42. And we'll see that in a little later exactly what I mean by that. Here, I just wanted to give you kind of an idea of what types of questions and what the tool looks like. You'll answer this tool and you'll upload the tool, completed tool to its separate place in the FTP site as well. I highly recommend all monitoring packets should be out on Friday. I highly recommend you and your organizations to start reviewing those monitoring tools once you get them. Any questions about fiscal monitoring? Next is universal monitoring. And so the universal monitoring, we encourage you to please, again, review the national monitoring standards. They have recently been updated. There's not too much change from previous year to the current year, just the formatting. Again, like fiscal monitoring, we will ask you to upload compliance documentation to the FTP site that aligns with the universal monitoring questions. And if for any reason we have any questions or concerns that we would like to talk to you about, we will schedule a one-on-one Zoom meeting interview to answer those universal questions as well. And so types of things, yes.
Jerry has his hand raised.
Oh, Jerry, thank you. Yes, sir, Jerry.
Of course I do. You know that.
One question, Jerry, one question.
So I'm assuming relevant to some of these uploads that you're going to be looking for upload policies, procedures, fiscal policies. How large document can your FTP site handle?
That's a great question. We do not have a cap on what the FTP site can upload. And that's kind of, Jerry, why we moved to that, because sometimes emails are like, yeah, 25 gigs stop or something like that. This you can definitely upload as large as the files you can put in there.
Thank you.
You're welcome. And then while you have access to the FTP site, little cheat sheet, if you need to send somebody some large files that are secure, you can do that while you have access to the FTP site. So poke around in there while you have access to that as well. It allows you to send some secure large files. And that's a great question, Jerry. Thank you. So when we talk about universal monitoring, this typically lends itself to policies and procedures that are required by the government. So making sure access to care, eligibility determination, anti-kickback statutes, and salary cap limits, right? Making sure you cannot pay yourself more than $209,500 through grant funds, right? Because I know everybody's making that salary cap level, right? All right. And so when we look at the universal questions, this one has some more programmatics added to it. So for instance, not everybody's funded for EIS. However, if you are funded for EIS or some of these particular items that are questions here, then you will have to upload compliance documents. So let's take a quick look at EIS. So if you are funded for EIS, you must upload your memorandums of understanding with key points of entry into care to facilitate access to care for people who have positive HIV tests. Also, if you provide EIS, you must upload your policies and procedures to demonstrate referral services for HIV positive clients to improve HIV care treatment at key points of entry. Upload documentation of HIV testing activities and methods that meet the Centers for Disease Control state requirements. You must upload your linkage agreements with testing sites where Part A is not funding testing, but is funded for referrals. And you must upload your policies and procedures to demonstrate referral services for HIV positive clients to improve HIV care and treatment, right, at key points of entry. And another one would be health insurance premium cost sharing. If you're providing HIPSCA services, you must upload documentation for funding where used to cover costs associated with the creation, capitalization, or administration of liability risk pools. So, you know, as you go through those, excuse me, there are some specific requirements for specific funded services. For those services who have like a certification or certification or licensure requirement, you will be asked to identify each of those people who are required to be licensed or certified and ask you to also upload their most current license and or certifications. Some other questions that take place also in the universal monitoring standards, again, are policies and procedures for provision of services regardless of an individual's ability to pay, right? These are some of the standard policy and procedures that Ryan White has required since the beginning of, or the inception of the program. again, this section is more about policies, procedures, and the administrative side of the programmatics. All right, so any questions about Universal? My apologies. This is where we'll get into what the FTP site looks like and what the expectations are. So the FTP site, and that stands for File Transfer Protocol Site, Access and Upload. So subrecipient staff are responsible for uploading and or reviewing compliance documents for your individual agencies, either for Fiscal, Universal, or both, will need access to the FTP site. A link to request access to the FTP site will be included in your site visit monitoring email. So on Friday, we will send out monitoring notices, and that will give you a notice that recipient's office and the consultant, which will be Collaborative Research, are either coming on site or scheduling a Zoom meeting with you to conduct the annual site visits. In that, you will have a couple of different documents. You'll have your site visit schedule, you'll have all of the monitoring tools, and you'll also have the link to request access to the FTP site. Anybody you need at your organization or agency to have access to those, you will be able to designate at that time whether you want them to have access to Fiscal, Universal, or both. So that will help out tremendously. And then keeping in mind, again, the FTP site is web-based and HIPAA compliant. You should not upload any private health information to the FTP site, right? So if you're uploading documentation that has client names or identifiers, please redact those with a black marker. If it's impossible, please let myself and Millie know. Again, it is HIPAA compliant, so we will be able to accept the documents. However, we do not want to make that a practice. So we'll review them and immediately delete those. Secondly, uploading compliance documents. Many questions in both the Fiscal and Universal monitoring tools will require subrecipient staff to upload compliance documentation. The FTP site is set up to align directly with the monitoring tool. So for example, if you're planning to upload compliant documents to question 10 in Fiscal, then you will simply drag or drop. So that's the good thing too. It's a drop and drag type of situation, or you can click upload and upload whatever documents you may have sorted, and it will go under Fiscal. Question 10 will be Q10. If the question is not applicable to your organization, you will choose no, or simply type NA and other and continue to the next question. Right, so what does it look like exactly? So once you get the link and your credentials to log in, you will be brought to this screen here. You won't have, your username is going to be a little more complicated. It's going to be your email address. You will be assigned a password from the very beginning. You may change your password once you log in. If you have any issues with your passwords, simply reach out to myself and we will get you reset and going. And again, for no reason should you ever share your login credentials. So please, please, please do not do that. We automatically get notes if we see your name's logged in twice at 2 places, and the site will automatically cut your login off. So please do not share your login credentials. So once you get into the FTP site, the file structure is divided into 2 files, right? You'll see your agency name. Once you click on your agency folder name, you'll see Fiscal and Universal as you see here. So for instance, for this particular example, I clicked Fiscal. Next, it brought up all of the there's more than this, I assure you, 40 questions. It will bring up all the boxes that you could possibly have compliance documents to upload to, right? So if it's a question that's a yes or no, just a simple answer, and it does not require you to have uploads, there will not be a folder for that question. So Fiscal, we're answering question 10. And then here are all of the documents that we uploaded for that particular question to show compliance, right? Does that make sense to everyone? Okay. Any questions about the FTP site? Seems pretty simple, right? All right, the next fun part. Yep, my computer will, there we go. So here we'll take a look at the chart pools and the monitoring schedule. So when we talk about chart pools, that's how many charts we're going to review out of the total number of clients that you serve. So for instance, Bergen family, you're scheduled for September the 27th and 28th. That will be done virtually, and your staff member from Collaborative Research will be Derek Jackson. So we have our different initials here. So DJ is Derek, MK is Michael, TRS is Thomas, and SS is Sarah. Right. And again, you don't have to copy this all down. You will get this in your monitoring notice, but this just gives you kind of a quick view of what the expectation is. So we'll be reviewing 40 eligibility charts, 25 EIS charts, 18 mental health charts, and 50 of your outreach charts for that day. Buddies of New Jersey, your monitoring visit will be October the 5th, 6th, and 7th on site. And I will be conducting review of all of the service standards for eligibility, EIS, mental health, medical case management, oral health, substance use services, outpatient, outreach, non-medical case management, psychosocial, food bank, and medical transportation. CAPCO, you are on October the 5th, 6th, and 7th. That also will be on site, and Derek Jackson will be completing a review of eligibility, medical case management, substance use services, outpatient for regular and MAI, outreach services, MAI, non-medical case management for regular and MAI, psychosocial, medical transportation, and health education risk reduction, MAI. City of Passaic, your monitoring visit will be October 4th, 5th, and 6th virtually. Michael Coran will lead that process. Again, he'll be reviewing eligibility, mental health, health insurance premium and cost sharing assistance, substance use outpatient for regular and MAI, non-medical for regular and MAI, and health education risk reduction, MAI. Hackensack, on October the 3rd, I will be visiting to look at your eligibility, outpatient ambulatory, and medical transportation charts. Hyacinth, I will be reviewing you on September the 27th and 28th virtually. We'll be looking at eligibility, mental health, non-medical, non-medical, medical, substance use, outpatient, MAI, and non-medical MAI. Northeast New Jersey Legal, you will be on September the 23rd, and that will be virtually, and Sarah will be conducting that, and she'll be looking at your eligibility charts and your legal charts. Paterson Division of Health, Michael will be conducting your site visit on 9/27 and 9/28. And he'll be looking at eligibility, oral health, and outreach services. Paterson Counseling on 9/19 and 9/20 virtually, and I'll be conducting site reviews for eligibility, outpatient ambulatory mental health, substance use services, and non-medical case management. Pain, your monitoring visit will start on September the 19th, Monday, Tuesday, and Wednesday, 9/19, 9/20, 9/21. Michael will be conducting review of your eligibility, substance use, outreach, non-medical, and health education risk reduction charts. St. Joseph's, I'll be conducting an on-site visit on October the 4th, and I'll be looking at your eligibility and outpatient ambulatory charts. St. Mary's, Derek will be conducting your review of eligibility, outpatient ambulatory, and medical case management charts on site on October the 3rd. Straight and Narrow, Derek will be conducting your virtual site visit on September the 19th and 20th. He'll be reviewing 25 eligibility, 25 non-medical, and substance use outpatient. And Team Management 2000, your virtual site visit will take place on September the 22nd and 23rd. Sorry, I did not want to cough in everybody's ear. And Michael will be reviewing your charts for eligibility, substance use, outpatient, regular MAI, outreach, regular MAI, and health education risk reduction, MAI. Now, probably a question that's already come up. Mr. Jerry, I already know. We may not need, we may not need all of the time that we've scheduled, but we'd rather schedule extra time and give you back a day or give you back a couple of hours than asking or begging you to schedule another day with us. If for any reason at the end of our scheduled time we haven't finished everything, we will have already made preparations to review at least 20 charts in each of the categories, and we may forego, with the recipient's permission, the remainder of the chart. So if you're scheduled for 50 charts and when we get 25 done, then we will talk to the recipient's office to see if we need to come back or if that's acceptable. Mr. Jerry, yes, sir. Oh, you're on mute, sir.
This is actually a funny question. How do I get the hookup and get a Zoom site visit as opposed to an on-site site visit?
You'll have to talk to Millie.
Actually, that's a funny. Actually, I prefer on-site because it's easier to grab stuff.
I can't accept bribes like out in the blatant bribes.
No, it's fine.
I'm
I'm
messing with
kidding.
Yeah, we prefer on-site as well. It's just we schedule this kind of quickly. So unfortunately, we did have to do some of those virtually. So that honestly, we weren't flying back and forth from all over the country in and out every week. So those site visits that are conducted virtual, you will be receiving a Zoom link that will be linked to your monitor from Collaborative Research. So I'll pick on City of Passaic. You'll get a link in the calendar invite from Michael for the 10-4, 10-5, and 10-6 days. The expectation is that there's a staff member who walks us through the charts as we go through. Depending upon the monitor, they may ask to see a particular item. They may ask you to give them specific dates to confirm that certain things have taken place. Again, so virtually, it is kind of on the honor system. We're taking you at your word as a professional that you honestly do have charts that you're reviewing with us and that you're giving us legitimate documentation from those. So we do hope that typically virtual goes a little faster. One thing we do ask, if you are using an electronic medical record, our preference is that you do not share the screen. We want to minimize as many HIPAA compliant issues as possible. We do not want you to share a screen that has any type of PHI, simply because we can't guarantee you that there's nobody with us, and we just don't want to be making any type of HIPAA issues. So for those of you who have paper charts, if you can just simply walk through the paper chart with us during those times, that would be great. Any other questions about monitoring?
I have a question. You said
Yes,
that
ma'am.
the months were going to be for 2021.
Yes, ma'am. For entire grant year, the one that just happened. So March 1st of 2021 to February 28th of 2022. Again, we will send this out. We'll also send out the PowerPoint so that you can have access to this as a reference as well.
And what if you have a scheduling conflict for your dates?
So we're going to do our best to not reschedule anything. So if it's an extreme issue, please work with Millie, and then we can see what we can do. But for the most part, we don't have too much flexibility in moving dates around with 14 service providers. And I'm just going to throw this out there. If you also serve on the CQM committee, one of the recommendations that we want to make going forward to the recipient's office is for chart reviews, is if you have a low underscoring performance that's within a certain threshold, but below the 90% mark, it's an opportunity for you to identify a quality improvement project, right? And instead of having a corrective action plan and writing a bunch of reports, it's an opportunity for you to study what the issue is, see how you can fix that issue, and do a project to increase your efficiencies. All right. Service category chart review, and that's what we just talked about with the chart pools and with the dates. So we will be utilizing the Bergen-Passaic TGA service standards, policy clarification notice 1602. Make sure you grab the most updated 1602. There have been some updates to that. And also the national monitoring standards that were recently released. Again, some of the site visits will take place on site and virtually, so please plan accordingly. And if you're wondering how we came up with the sampling methodology, if you had 1 to 24 clients receiving a service within a service category, we are reviewing 100% of those service clients. If you have between 25 and 50 unduplicated clients, we're reviewing 25 random charts. Between 51 and 100, 30 random charts. 100 to 499, 40 random charts. And if you have more than 500 unduplicated clients, we will be reviewing 50 random charts. For those of you who are statisticians, this is about a 90% confidence interval with a 10% margin of error. Did anybody get excited about that? Because we need you on the CQM committee. Okay, Ms. Donna, we're already on. All right, monitoring site visits. So each site visit will begin with an entrance interview. We ask that subrecipient have an opportunity to introduce themselves, talk to us about successes, strengths, and challenges throughout service delivery. Because again, this process is not just about what's going wrong. We also want to hear what's going really right. Again, so we can share these things that you're doing across service delivery and also share them with HRSA. As we all know, we're coming out of COVID. We're still kind of in it, but we're rolling back into some more in-person availability of services. We want to hear what's been working for you and what you've been doing really well. Another portion of this is the quality management interview. This will take place after the monitoring is completed. We've already talked about this in CQM. We'll be doing an organizational assessment. There's some things happening at the recipient's office that we're kind of pushing back a little bit on the organizational assessment until some more people are in place. And then we'll start that, because we want to make sure we rope everybody in on this and that we're all doing this as a team. So the organizational assessment will come a little later. And then each monitoring visit will conclude with what we call an exit interview. Here, we will give you very high-level outcomes of what has taken place, what we may or may not be recommending as a corrective action or a finding or an opportunity for improvement, and just give you very high-level data. Please keep in mind that no matter what we give you as a result before we leave, the recipient's office has the final authority to determine if something's going to be a corrective action, if it's going to be an area for improvement, or if it's not going to be a finding at all. But we will let you know everything that we are going to recommend prior to us sending our reports to the recipient's office. Final monitoring report should be to all of the subrecipients no later than November the 30th. Subrecipients who are required to submit a corrective action plan will have to do so within 15 business days of receipt of your monitoring reports. Again, monitoring reports will be divided into 3 categories: satisfactory, requires improvement, and finding or corrective action. Again, there will not be preliminary reports. There will only be final reports issued from the recipient's office and corrective actions 15 days after that, if you are required to do a corrective action. So what are the next steps? Monitoring packets. Collaborative research in concert with the recipient's office will distribute monitoring packets to each subrecipient by Friday, September the 9th, so this Friday. Monitoring packets will include your official notice of intent to conduct the annual site visit, a site visit monitoring schedule, the CR team member assigned to conduct your on-site monitoring, the monitoring tools, and instructions for document upload to the FTP site, which will also include an opportunity for you to request access to the FTP site. Chart pool list. The recipient's office will provide to each subrecipient a list of random charts monitored for each service category. You will get your chart pool list 5 business days prior to the scheduled site visit. So those of you who have site visits scheduled for the 19th, I can't see my name. You should get your site visit schedule by next Monday, if my computer will work with me here. Anybody give me that date, please? The 12th, there we go, the 12th. You will get your site visit chart pool list by the 12th, and then each subsequent day, 5 business days in advance, subrecipients will receive that information. The FTP site uploads. Everybody will be asked to have all of their FTP site uploads completed no later than October the 21st, which is a Friday. That will allow for my team and us to review your documentation for compliance and schedule any type of follow-up interviews that may be necessary. And again, if there are any fiscal or universal interviews that need to take place, we will do those on an as-needed basis. So there's no need to plan for that in advance. If we have questions, we will reach out to each individual to conduct those interviews. And then finally, if you have any questions, please send an email to both myself and Millie so that both of us are in the loop. If by chance you forget to include one of us on the email, we will respond back and include the other. So please, if you can, just include myself and Millie on all emails. Again, it's thomas@collaborativeresearch.us, and I'm pretty sure all of you have Millie's email address. misquieto@patersonnj.gov. All right, I will stop sharing. Are there any questions, concerns, thoughts? All right. Well, I am looking forward to a very successful year of monitoring. We hope that we're able to continue to do this in the future because it will also help us with a couple of different operations that we already assist in, with updating service standards, updating service delivery models, and especially in our clinical quality management committee with looking at quality improvement projects. So hopefully we'll get all of the monitoring done. And if anybody has any areas for improvement, you'll be able to roll that into your first half year quality improvement plan starting in 2023. So if you're a data person, get excited because this is going to be a lot of great data for you to take back. If there are no other questions, I will end the call and we will make sure that the link is available to you and your staff for this process, and we will include the PowerPoint in your monitoring notice. Are there any other questions?
When did you say we're going to get our packet to start looking at?
Friday.
Friday.
Sir. All right, if there are no other questions, I'd like to thank you again for your participation in the technical assistance webinar. Millie, anything from you?
Oh, I'm sorry. One more question related.
Yes, sir.
So do the providers need to, well, I don't know how it works, but in terms of us receiving the packet, do we need to also identify the person who's going to be responsible for a particular piece of the pie of what you're looking for?
That's a great question. Yes. So we will have what we call a single point of contact. So if you are the person who originally received the invite to this meeting, you are the point of contact. We would expect executive directors or COOs or program managers to distribute those to the people who are responsible for other portions of the monitoring process. Again, that's why we're also going to make available the recording for today so that if you have other staff members who are not able to make it today, they'll be able to review and kind of get in the same input as we did today.
And I get that part. Okay, so we have to make sure our people get what they need. However, at the same time, when you're doing the actual site visit, be it virtual or in person, do we need to notify you who that person is? Meaning, you know, going back to you, so you know who to ask for, who to email, or who to whatever with. Does that make sense?
No, sir. It does make sense. We only want to have one single point of contact who's going to lead the process for each agency. Gets a little confusing when there's 7 or 8 different contacts. So more than likely, we're going to ask just one person. So if we show up on site and you've already identified, let's say that Miriam is going to do your medical case management review, that is on your call, sir.
Okay.
Yep.
Well,
And
yeah.
the same thing with virtual. Yep. We don't want to assign your staff. We know that you already have a heavy lift in providing services all day. So however best fits your schedule. So even if, for instance, you're funded for 7 different service categories and you know that, and we're coming to see you for 3 days, I would prefer that each individual place schedules how they want us to review those documents because maybe your mental health provider is not available on Tuesday. So I would rather you schedule that out so it works best for your staff schedule than it works for mine, just as long as we get it within the time frame that we're visiting.
We'll feel it out. Okay.
Thank you, Jerry. Great questions. All right, any other questions? All right. Again, thank you for joining us, and we look forward to a successful year of monitoring. Thank you, and have a great day.
Thank you very much.
Good afternoon.
Thank you.